Hi everyone, my name is Syndy Sosa and I'm going to be presenting my research on prenatal classes and the effect on preterm labor. So my introduction, I just included a couple of facts. First, preterm birth is birth that occurs prior to 37 weeks gestation. In 2015, 1 in 10 infants born in the United States were born premature. Preterm birth is directly correlated to low birth weight, and it is the leading cause of neonatal death. Premature labor puts neonates at risk of complications at birth and chronic illnesses later on in life. Such risks are jaundice, chronic respiratory illness throughout life, longer hospital stays at birth, feeding and digestive problems, vision and hearing loss, cerebral palsy, and intellectual disabilities. So, while there is an extensive amount of research regarding the risk factors of preterm birth, there is limited evidence on non-pharmacologic intervention methods to reduce the rate of preterm birth in the United States. There are a few studies that review the effectiveness of a method called centering pregnancy, but so far this is the only method I've encountered in the research. There were also studies done on home visits. However, these don't directly correlate with the intended purpose of my study. So the purpose of this study is to identify if group prenatal classes affect the number of women delivering before 37 weeks of gestation. So my research question is, does the participation in group prenatal classes reduce the rate of preterm birth, labor prior to 37 weeks in pregnant women? The independent variable, which is a nominal measurement, are the prenatal classes, attending the group classes or not, and just receiving standard medical care. And the dependent variable is an interval measurement, which is the gestational age at time of delivery. The research design would be a randomized controlled trial. Inclusion criteria would be patients over 16 years of age or older, primigravidas or multigravidas that have never experienced a miscarriage or preterm birth. They need to be between 20 to 29 weeks of gestation, English or Spanish speaking, and low socioeconomic status. Exclusion criteria would be those patients that have experienced preterm birth and women over the age of 35. Due to the nature of the intervention, the exclusion criteria that I've stated, these factors have been found already to increase the risk of preterm birth, and they're not modifiable. So if these participants were to be included, they would alter the results of the study. So data collection. So my target population would be those from a low income community, so those from community healthcare clinics. The participants will need to have consented to participate in the study before knowing if they're part of the intervention group or the control group, just to stay true to the randomization process and to avoid any bias. The surveys completed prior to the study will determine eligibility and assess baseline. The survey content will cover any medical and psychosocial risk factors that the participants may be experiencing, as well as knowledge deficits and their interest in what they want to learn. By reviewing this, it'll help tailor the classes appropriately. The group classes will span over the course of 9 weeks, and each week would cover a different topic such as nutrition, gestational diabetes, pain management, and stress management, just to name a few examples. The post-intervention survey evaluations of the classes would be completed for the intervention group, and gestational age at birth will be compared between the intervention and control group. So the sampling method that would be used for this study would be stratified sampling. The type of analysis would be difference. It would be difference in results based on which participants received the intervention of group prenatal classes, and we would use a t-test for the statistical analysis. This would be the most appropriate because we're testing between two different independent groups, the experimental versus the control. So limitations to the study would be sample size, first of all. I found an underlying common theme in the majority of the current research that showed an insufficient sample size was obtained to ensure validity of the studies. So once the results were reviewed, many of the researchers determined they required a much larger sample. So this would definitely be one limitation to the study, and another would be time frame available for the study. So time availability may be a limitation due to the nature of the study. This would be a lengthy process to screen participants who are eligible and willing to participate, then carrying out the intervention of a 9-week course, and finally awaiting the participants to give birth to compare gestational age at the time of labor and see if the intervention was effective. So the theoretical framework that'll be tied to the study would be Pender's health promotion model, which is a middle range theory. This model focuses on health promoting behaviors such as wellness orientation and activities directed towards a person's well-being. By using the health promotion model, the researcher can assess the patient's current level of knowledge and their level of motivation to improve their behavior and their overall health. So from gathering such data, the researcher can develop an appropriate prevention intervention that would render valuable knowledge to the patients or participants in this study. And here are my references. Thank you so much. Any feedback would be greatly appreciated.